It feels like everyone's sick right now, and the question I keep getting in the comments is, why is this happening? Well, all you have to do is to think back to last year, or the year before that, or before that, or before that. But it's kind of like clockwork, where this is the time where respiratory viruses act up and start increasing. And the three big ones are the flu, the virus that causes COVID-19, and RSV, or respiratory syncytial virus. And those just increase in numbers and make a whole bunch more people sick at this time of year. So there's a couple of reasons for that. Some of those are viral factors. Some viruses just do better in the drier and colder air. They survive for longer. But most of it is human factors. We tend to be more indoors when it's cold outside, and so viruses have an easier time spreading indoors compared to outdoors. Also, this is that time of year, from American Thanksgiving right through to Christmas, where there are a lot more get-togethers with a lot more people. And the more people there are, the more opportunities these viruses have to be present and then to spread. So what can you do? Well, it's not rocket science and it's nothing new. If you're going to a very crowded place with a lot of people, that's where you have an increased chance of getting sick. Try to improve ventilation in that setting, open windows, open doors. Put on a mask. That will protect you from other people's viruses. It'll protect other people in case you have a very early asymptomatic or pre-symptomatic infection. And if you're sick, definitely don't go to that get-together. And also wash your hands a lot, because we know that we can catch these viruses from surfaces, and we tend to touch our nose, our eyes, our mouth, and that's how these viruses get in. So all of those things will prevent you from catching the virus, but inevitably many of us will catch these viruses, or one of these viruses, this season. So the other thing you can do is you can protect yourself from getting really sick from the virus. So getting a vaccine will prime your immune system, prepare your immune system so that when the virus does hit you, you're ready for it. And you will have less prolonged disease, less severe disease, particularly if you're susceptible, if you're older, if you have a weaker immune system, if you have a chronic disease. It becomes really important to prepare yourself for that virus. And the good news is that for anyone who's 6 months plus, we have a vaccine for the flu. We have a vaccine for the virus that causes COVID-19, and we have a new vaccine. So even if you've had the virus before, if you've had a booster before, there's a new booster this season that's sort of adapted to the current strain of COVID that's going around. And then the other good piece of news is that for RSV, in the last couple of years, we've had a new vaccine now. So anybody who's 60 plus should be thinking about getting that RSV vaccine as well to protect themselves. So lots of people are sick, but actually more people will get sick. Usually this peak increases as we get into the first couple of weeks of January, because we're sort of seeing the effects of the Christmas get-togethers, where people take a week or two to get sick enough to then enter the healthcare system. So even more people are about to get sick, and there's a whole lot of stuff you can do to protect yourself and reduce your chances of getting sick. Have a healthy and safe holiday season.